We are here for another Ask the Doc session. My name is Laura Patrick, and this is Dr. George Aitken, orthopedic surgeon here in Ashland, and he also sees patients in Flatwoods. February is upon us with Heart Month. It's nationally recognized with Heart Month, and funny enough, cardiology and orthopedics are very interconnected. Dr. Aitken, do you want to talk a little bit about how cardiology and a good heart impacts orthopedics?
Well, we have a lot of patients in common because our patients may have some of the same underlying problems. So people who I see generally in orthopedics with, for example, joint replacements in an older population, they tend to be older, for one thing. They tend to be heavier. They may have heart problems because of being heavier. Because of their knees or their hips, they can't exercise as much as they would like to. And those are all just risk factors. We see patients who have some bad habits, perhaps like smoking, which affects the heart, it affects the bones, and actually interferes with healing of the bone, interferes with healing of the cartilage. So eventually, a lot of the patients that I see have some underlying cardiac problems. And in some cases, it's hard to tell which is the worst problem. So we work with the cardiologists in getting medical clearance sometimes, because a lot of these people will have histories of problems. And also, if they have atrial fibrillation, they're on chronic anticoagulation, we need to coordinate that to make sure that it's okay to stop their medications or to vary their medications as we need to. This even goes back at the very early part of orthopedic practice with even sports medicine, because when we do sports medicine, the patients will get a physical, and one of the major things that we look for are for changes for a cardiac condition called subaortic stenosis, hypertrophic subaortic stenosis, I believe is the correct answer, but where the sudden death syndromes, and people are screened for that in our clinic. So cardiology is involved right from the beginning. So we have people who will come in, and most people don't come to their orthopedic surgeon and say, I've got chest pain. At least I hope they don't. But a very simple thing is, how far can you walk? How are you limited? Are you limited? I will ask patients, how far can you walk? And they'll say, oh, I can only walk about a block or a flight of stairs. What stops you? Well, I get this pounding in my heart. My knees hurt, but it's my chest that's bothering me. And so those people go to the cardiologist, and they get cleared first before they have their treatment. But I will also get patients who are doing cardiac rehab after they've had a cardiac event, and they come to us because they say, well, I can't really do my exercise. I can't progress the way I want to in my cardiac rehab because my knee hurts or my hip hurts. So again, we work together with a lot of these things. The dietitians, they put them on an appropriate heart healthy diet, a weight reduction plan, because it's not really a diet. It involves a lifestyle change, and that's the biggest difference that I think is changed from, say, 20, 30 years ago. Well, you had a heart problem, or you had a bone problem, or a joint problem. No, it's the whole patient who is having the problem that needs to be dealt with as a group. It might be the heart is a little bit more important at this point in time, or a little bit more evident, but all of them work together, because if you can't exercise, you won't improve your heart. If your heart's not strong enough to let you exercise, it's a different question than if your knee is not strong enough to let you exercise.
Right, and I know earlier you had mentioned smoking, and the risk of smoking is obviously very bad for your heart and very bad for your bones and joints. Will you talk a little bit about how smoking affects the healing of?
Well, smoking affects in different ways. Smoking is actually a significant cause of osteoporosis, which most people don't think of. In males, smoking is probably as much of a risk factor as drinking a lot of soda, which is a risk factor because of the phosphates. And so the strength of the bones is impaired by smoking. If you end up having surgery, it interferes with the healing not only of the deep tissues but also of the skin. In patients who have fractures, the biggest thing that you can do to allow your fracture to heal is quit smoking. And there are a lot of surgeons who, if a patient comes in who has a problem with certain types of bad fractures or what's called a non-union, where they've had a break and it just hasn't healed and they're going to need more surgery to try and make the bone heal, if they're smokers, we won't do them because it's not going to work. Okay? So it has a direct effect upon the bones, upon the healing, and it has the effect upon the heart because we give antibiotics around the time of surgery, and we joke that the purpose of the heart is to send the antibiotics to the bone, but smoking, unfortunately, is not a particularly good thing to do.
No, it's not. And it is fascinating to hear how the physicians in cardiology, the orthopedic surgeons, they continually communicate for the care of the patient and see that they are taking care of both a good heart and then healthy bones and joints, and they go hand in hand.